Hello dear friends, I am Dr. Easwar T Ramani. I am the Senior Consultant Pediatric Orthopaedics and Scoliosis Surgeon at Baby Memorial Hospital, Kozhikode, Kerala. I would like to welcome you today to our video presentation and also would like to offer you the services we offer for the scoliosis patients. We would look at what scoliosis is, what are the options of scoliosis treatments we do here at Baby Memorial Hospital, and our team, an entire team who is specialized in taking care of your child through the various steps in your scoliosis surgery and post-surgery. We would leave you with the thoughts as to why you would like to consider scoliosis surgery at Baby Memorial as your favored destination. So what is scoliosis? A scoliosis is a S-shaped bend, a spiral bend in your child's spine. This can occur at different age groups. You can have children having the bend even at the age of 1 year. So that is the first time the parents notice this. When they bathe the child, they suddenly see that there is a little bump on one side of the spine and rush to us. That is called congenital scoliosis. This is detected soon after birth. You may either see it as a tilt of the head, an uneven shoulder with one shoulder above, or there is a bump on one side of the spine. Or it may come during the first few years of life, about first 3 years of life. At that time it is called infantile scoliosis. It may be picked up between the ages of 5 and 8 years as well. In otherwise normal child, suddenly the mother may see that one side of the rib hump, the rib is bumped on one side of the spine. This is usually noticed when the child wears a tight dress like a t-shirt or active in sports. Suddenly this becomes obvious. It may be hidden under loose dress. After the age of 8 years, you still have possibility of getting scoliosis that is between 10 years up to 15 years. Another type of scoliosis, which is the most common one we see, is called adolescent scoliosis. So typically, the adolescent scoliosis in an otherwise normal child suddenly spurts with the child growing, usually in the years 1 year prior to the puberty. So that is when the child's growth is at the fastest rate. And suddenly you see that an otherwise normal child suddenly having a scoliosis. The mother is sometimes very, very anxious as to why this has happened so suddenly. So this is why when the prepubertal growth spurt, we call it, happens, suddenly the scoliosis magnifies. So this is the broad overview of scoliosis. So how do we treat scoliosis? We have all the treatments all the way depending on the age and the type of scoliosis. We have, as for a child who is less than 1 year, we offer what is called a casting. The casting is done under general anesthesia. It is the regular plaster of Paris casting, and we mold the bend and hold on to the cast for a period of 3 months at a time and change it. When casting or the type of the curve is not appropriate for casting, then there may be situations where there may be a role for early surgery. Now, we don't want to operate on the child so young and fuse the spine, join the spine together, because we want to allow the spine to grow. So the modern trend in spine surgery, even when a surgery is needed very early on, is to allow the spine to grow. And for that, there is something called the growing rod surgery. In some situations, guide the growth of spine in such a way that the growth, as it occurs, will take the bend away. That is called vertebral body tethering, and this is the new trend that is slowly picking up in the field of scoliosis surgery. That is called vertebral body tethering, where you allow only one side of the spine to grow and the spine slowly corrects itself. But once past the initial few years of life, and once the child is about 10 years, then these interim measures don't play on very much. We need a definitive solution for the scoliosis. In those cases, we need to operate, correct the bend, and fuse the spine. So that is the most common scoliosis surgery we do. And this can be done depending on the child's curve and the angle we measure on the X-ray. This can be done from behind, that is called posterior. It can be done from the front, which is called anterior. And in some situations where the child is picked up very late and the curve is very, very rigid, we may need to do it from the back and the front. All these decisions, technical decisions, are taken once the child is examined, and then our team goes through the regular tests and the requisite X-rays and maybe even a CT scan. Beyond these regular types of scoliosis, there is a large section of scoliosis we treat which do not start with scoliosis. The child has an entirely different set of sicknesses which cause the scoliosis. This is called neuromuscular scoliosis or syndromic scoliosis. We treat a large number of these children where the child has an issue with the neurological system which eventually leads on to scoliosis. So we have spina bifida, which is a spinal cord issue in the child, cerebral palsy, which is a problem in the brain, and then that results in scoliosis. There is something called SMA, spinal muscular atrophy, and there are any number of other diseases which fall under the muscular dystrophy, all of which can cause scoliosis. Sometimes even as simple an issue as a leg length difference can cause scoliosis. Some children may have issues with the hip joint, which can start off a mild scoliosis. So we need an overall assessment of the child. It is not just the spine we look at. We look at the child as a whole. We need to assess a proper pediatric orthopedic assessment of the child. Then we plan this treatment of the child. So this is in brief the introduction to scoliosis and the treatments that can be done.